If this type of model became part of a lot of communities, first of all, mental health would improve. We survey our community members and their lives have become enriched through participating, whether they're giving or receiving. The benefits for older adults are great, but it's really the connection piece. We know people are becoming more isolated for all sorts of factors. People don't know their neighbors as well as they used to. The issue sometimes is, how do you interact with your neighbor? You know that they want to interact with you, but if there's the vehicle of service built in, that can make it less awkward. And then the ice breaks. Service as a vehicle for connection. It's just a wonderful thing. In a perfect world, a little help would go out of business because people would just do this naturally. But unfortunately, it's not the case, and so that's why we exist.
Welcome to the Care We Need podcast, where we bring together patients and providers to explore how we can improve U.S. health, wellness, and human services systems to better serve the growing population living with complex illnesses. This podcast is brought to you by Bennis Companies, where we provide education, consulting, technology, and other resources to help health and wellness professionals streamline their systems and deliver better health outcomes for their clients. With us today is Jake Dresden. Jake is the Metro Denver director of A Little Help, a nonprofit that began as a small grassroots effort and has grown over the past 20 years to become the largest organization of its kind in the country. Today, A Little Help supports roughly 3,000 older adults by pairing them with volunteers for practical everyday needs. I absolutely love this conversation. I think what they're doing at A Little Help is amazing, and I know you'll enjoy it. Let's go. Jake Dresden, why don't you tell us a little bit about who you are and about A Little Help?
Yeah, who am I? I am the Metro Denver director at A Little Help, and A Little Help is a volunteer organization with the sole mission of helping older adults age in their homes by connecting them with volunteers to provide a whole suite of tasks, but more importantly, to provide companionship and connection that is lacking in today's world. So yeah, I've been with A Little Help now for 6 years, almost going on 6 years. And my prior career to working in this field was in education, working in middle schools and high schools as a teacher and administrator. So I actually come to A Little Help prior as a volunteer. Past career, I was a volunteer with A Little Help as well through my school and individually with my wife and kids. And so come to it from that perspective, which I think is pretty unique.
So you started as a volunteer and then became a member several years later.
Yeah. So A Little Help is actually celebrating our 20th year in existence here in Colorado, which exactly. We're really proud of. Not all nonprofits kind of make it that long. And so we're really excited to celebrate that and then to keep going. But yes, so prior to me coming on staff in 2020, I had been a volunteer with my wife and kids helping older adults in our neighborhood of Washington Park in central Denver. And when I went through a career change, I reached out to the old executive director and he let me know that they were hiring and he was going to step down. And he had someone in mind, who our current executive director, Hillary, and she kind of needed a right hand. And here I am, almost 6 years later.
So you started off helping kids, and now you're helping elderly folks. Is it so? What's the correct term? I don't want to offend anyone. Is it geriatrics? Is it old people? Like, what's the term? How do I say this respectfully?
I didn't ever really consider the terminology before I came on board, and we've kind of, after conversations with a lot of people in the field, kind of all landed on older adults.
Adults.
I think,
okay.
Yeah. For whatever reason, I don't think we need to parse it out per se. I use the word seniors a lot because people understand what that means, but older adults is what we use in all of our marketing. So,
all right. Note to self: older adults, not the other stuff.
Yeah.
The terms of respect kind of change over the years. So I just want to make sure I'm using the currently respectful one. So you moved from helping kids to helping with older adults. And there's a through line of your heart for helping people. And I want to dig into that a little bit before we dig into A Little Help. Is that something that you were raised with, born with, or is that something that you kind of came to later realizing this is really important?
Great question, Brett. There's probably multiple facets to it, but the most instructive thing I can tell you is going way back to my childhood. I grew up in Philadelphia in the 70s and 80s. And truth be told, I was kind of a pain in the ass as a as a student and as a kid in my late elementary, sort of early middle school, early high school years. For whatever reason, just kind of unruly, a little mischievous. And when I got to high school, my dad was actually an administrator at my high school. I kind of was going through the motions, and truth be told, I took a class from a guy, teacher. His name's Fred Lamott. He's a religion teacher, and he taught a lot of Eastern spirituality, Buddhism, Hinduism, you name it. And I really took to his class and to him. And he was kind of a quirky character at the school. He had a classroom in the basement of this old building, and not a lot of kids knew about it. But in addition to his religion classes, he led the service learning program at our school. And he convinced me to join him for one of these visits. And I had no idea what I was getting into. And me and a bunch of other kind of misfits at the school hopped in a van with him and went to some of the most destitute, poor areas of central Philadelphia in the 80s that were ravaged by crack cocaine. I'm giving you probably more details than you want. We worked with families, and I was scared out of my mind at first because I had no idea what I was getting into. But very quickly, I realized how good this work made me feel about myself, gave me an identity, made me think about people other than myself, got out of my own little bubble, and it really helped me mature really quickly when I needed it. And I give a lot of credit to Fred Lamott, my old religion teacher back in the 80s, for kind of exposing me to this. Then volunteering just became part of my person over the years. And I always, in my 20s and 30s, and when I was a teacher, I was always trying to find opportunities for kids to get out of the classroom and do something positive in their community, because I knew how much it meant for me. And I saw kids like myself that were struggling with whatever and acting out. And those kids, lo and behold, were the ones that took to service the most readily, and it was the most meaningful to them. And so it was kind of like recreating part of my childhood in my career as a teacher. And so it became just so meaningful and important to me. And so, like I said, more than you maybe want to know, but that's kind of the genesis for me, going way back and kind of helping me develop an identity and realizing really how volunteerism is often most beneficial for the volunteer, for the person providing the service. The person receiving service obviously benefits in many ways, but we really feel at A Little Help very strongly that the volunteers that participate get as much as they give. And it's a very reciprocal relationship. And we try really hard to blur the lines between who's giving and receiving service.
So it sounds like it gave you a sense of purpose outside yourself. Sounds like for the first time in your life. And that really kind of reoriented the trajectory of your life, those early years volunteering. And it sounds like that became a core foundational element for how you live the rest of your life later on, just understanding this is what I'm here for.
Yeah, I think that's fair to say on a lot of levels. Not that other experiences weren't worthwhile. There's a lot of other interests that I have that I developed over the years that are meaningful, that are beneficial, that are positive for society and me and people around me. But volunteering really probably was the most transformative for me at a time when I needed it too. And I didn't know, when you're 16 years old, you don't really understand the full grasp. All I knew is I felt good when I was doing this. And that was it. That was the spark.
We'll get back to that conversation in just a minute. Right now, I want to let you know about two powerful keynote speeches that Tenay Benes is offering. One to help care organizations improve their systems, and one to help empower the people navigating complex illnesses within them. Her first talk, Win the War on Complex Illness, comes straight from the battlefield. As an intelligence officer in the United States Army, Tenay took the worst performing brigade in her area of operations and helped turn it to the best, using a framework she calls the 4 steps to winning a war. Now she brings that framework to health, wellness, and human services organizations so they can improve complex illness outcomes without rebuilding from scratch. Her second talk, Heal or Die, is deeply personal. Tenay spent years battling complex PTSD, chronic fatigue, depression, anxiety, and suicidal ideation. Today, she's thriving as a wife, mother, author, and entrepreneur. In this keynote, she shares the mindset and lessons that helped her take back her power, reclaim her life, and achieve real results despite disintegrated health, wellness, and human services systems in the United States. This talk is perfect for veteran groups, patient and caregiver associations, elder care groups, and civic organizations. Visit tenaybenes.com/speaker to learn more or to book Tenay for your next event. All right, back to it. That's awesome. So tell me a little bit more about A Little Help. You just said that it's 20 years old. So it reached its 20th birthday this year.
Yep.
And we overviewed it a little bit of it connects older adults. I think I remember that one correctly. Older
Yeah.
adults with people who can help them with everyday tasks. Is that mostly kids helping them out? Is that all age range helping them out with all different types of tasks? What does that look like?
That looks like a lot of things. Yeah, yeah, to just kinda back up, like I said, yeah, we're 20 years old, started in 2005 in Washington Park, just as a little grassroots group of neighbors that, had actually seen our model, in action on a trip to Boston, and A Little Help is one of a national consortium of, organizations that are called villages. A village is an organization dedicated to helping older adults through volunteers. And so there are villages all across the country. If you Google Village to Village Network, you can log on and see villages in your neck of the woods if you're in Cincinnati or Portland or San Diego or wherever you are. Little Help is actually the largest one in the country. And yeah, to answer your question, the way it really works is when older adults who hear about us feel like they could benefit from some of the services we offer, but also the connection, they'll sign up with us. They go through a process to make sure it's a good fit. They're in an area where we have volunteers, and what they're asking for are things we feel like we could probably help with. Then they call us when they have a need. And we have about over 3,000 older adults that are part of our community. We call them members, and they call us and say, Brett, if you live in Westminster and, Tom lives down the street and he'd love to have someone come over and wash his windows. Or Betty, who lives in, Centennial, would love somebody to come over for a friendly visit once a week. Or, Tom, who lives in Wheat Ridge, needs someone to pick up his medications once a week. We then post those requests on our portal that then all of our background check volunteers, of which we have about 2,500 throughout the state, then have access to and can opt in to pick up things that they want to do based on their interests, their location, their availability, all of the above. So, if Brett, you're a volunteer, you could log on and see, oh, there's 3 people within 5 minutes of me. I think I could help Tom. I've got some time on Saturday to wash windows. I'll go, me and my partner will go over there, my wife, my kids, whoever, and we can do that. We form a connection. And if you and Tom hit it off and you want to just keep helping Tom, you can report back to us and we'll kind of chronicle what you're doing. Because what we're doing is we're the facilitator, we're the bridge builder, we're the connector. We're not doing the work. We're connecting people that wouldn't necessarily have a chance to meet each other or know each other. To answer your original question too, we're very intergenerational. We have older adults helping other older adults. We have, high school kids helping older adults. We have Gen Z, Gen X, millennials, whoever. It's intentional that way. We want people of different generations to have a chance to connect with each other through the lens of service. Because otherwise, how do you meet somebody that's 85? It's not natural per se in this day and age. And so we feel like we need to be that catalyst to make that happen.
That is awesome on so many levels. There's so much talk nowadays, at least in my circles and in the health and wellness, and talking with people about that, of the need for community care, the need for reintegration of community, the need for reconnection of different generations. And there's so many things that this design is doing, where one, there's the obvious benefit of older adults who need help are getting help, and they don't have to leave their homes. They don't have to go to an assisted living facility. They don't have to leave their communities. They don't have to leave the places that they know, which especially in cases where it maybe involves dementia or anything like that, that can be a really destabilizing event in someone's life. Absolutely think that the retirement homes and care facilities are amazing, but if there was an option for something that allows them to stay where they are, stay with their community, stay with the people they know, stay with the environment that they know, that's even more amazing. But then also bringing in the reconnection piece. There's so many different aspects, whether it be young professionals having to move to different states to be able to do their work, and then they losing connection with the intergenerational relationships that they had growing up, or maybe people who never did have them. And then just people who are wanting to either help out or they're wanting to reconnect. There's so many different things that this design is doing that American society absolutely needs today. And so I'm ecstatic that this exists. And also you were saying that this is actually part of a larger network of groups. Sounds like it's not a Little Help network. It's more like Little Help is a part of a larger network of similar type groups. Is that accurate?
Yeah, the network is called Village to Village, if people are out there and want to Google. And the reason I always talk about this is because people may hear this interview and say, Jake, this is great, but I live here and my grandparents or my parents live in Wyoming or in wherever, in Austin. This doesn't really help me. And because A Little Help is just a Colorado-based organization. A lot of people have reached out to us wanting to bring A Little Help, our organization, to another state, and we've kind of resisted. We just want to focus on Colorado. There's so many people to help, People hear, oh, you helped 3,000 older adults. That's great. Well, we would love to put another zero at the end of that and help 30,000. And that's just the tip of the iceberg. But to come back, the network, brings villages together so they can kind of see what's going on. A lot of villages maybe they just have one thing that they focus on, social connection or transportation or whatever. And a lot of the villages are all volunteer run. So they may not have paid staff. So what their focus and their mission is very narrow, which is fine. But A Little Help is the largest. So people come to us a lot and like, how do you do this? Because there's a lot of things people don't quite understand about it when they hear it for the first time. They're like, well, what's your revenue? Do you match make? And we don't know. We don't do that. And one thing I point out is the older adults don't pay a dime for the service. And so taking financial out of the consideration frees us up in so many ways as an organization, but also as individuals. Like when you have somebody coming to your house to do something for you and you're not paying them, it changes the dynamic so much about how you interact. Because that person's there because they want to be there. They're doing it out of their own free will. And so it makes that connection so much more healthy and rich. I'm proof of that. Like when I started volunteering with my wife and kids, we met these ladies in our neighborhood that were in their mid-90s, that were still living in their homes, had raised families, grandchildren, great-grandchildren, and stayed in their homes with a lot of help from A Little Help. And they became part of our extended family. Betty, Rosemary, Beverly, all these women that lived in their homes in Washington Park and had these stories and, filled up my daughter's ears with, they went to the same elementary school. And this is what this was like in 1950 living here. And that's invaluable because I come from Philadelphia. My wife comes from Iowa. We don't have family here. And so, I think,
my wife and I are prior military. We've moved a dozen times. We're nowhere near our family.
Yeah. And this is it's an authentic way to make a connection. There are lots of authentic ways to make. You could join an art group, or you could, become part of a running group, whatever floats your boat. But for me, this fills my bucket.
So let me ask you a question about that piece where you said not being paid or not paying for someone to come and that dynamic. And you describe it as being a very positive thing. And I can definitely see that for some people. But there's other people I could imagine who maybe they might feel embarrassed, or they might feel, I know there's like a cultural, I don't want to receive any charity, that type of thing, especially in that age group. That's a lot larger thing. In my experience, it tends to be a little bit more of the men like that, but I think there's probably across the board. How has your experience been of that? And is that as common as I think it is, or is that really not something you run into?
That's a good question. I would say, to validate what you're saying, there definitely is a stigma in the generation that we're serving, primarily 70s, 80s, 90s, about asking for help. And not everybody wants to sign up. And it sometimes interferes with the whole notion of independence. But we're not very pushy. And truth be told, we also have no problem recruiting older adults to our community. We run a wait list. We're at capacity kind of almost every month in terms of bringing new people on. So we're not hurting to find older adults. Like I said earlier, though, we want to serve more people because we know it's right and it's good. But you're right. There are times when it's, a person will try to pay a volunteer, and the volunteer says, no, no, thanks. I'm just doing this because I'm a volunteer. And sometimes we have to have conversations with our older adults when they're kind of skeptical about, what this may entail, and let them know this is all on you control what you want to have done or not have done. If all you need is someone to shovel your sidewalk, that's fine too. If you're just, but we also then encourage them to try to make that connection down the road, because also their needs change a lot. Older adults' needs can change very rapidly. They may need one thing when they sign on and then realize that their networks evaporated and they want the connection or they need something else in addition to it. And truth be told, we have a lot of older adults that are volunteers as well, as you can imagine. And our very best community members are people that we call hybrids. They receive some service, but they also provide something. You might have a bad back and you can't shovel or rake leaves, but you can still drive somebody to a doctor's appointment. And those people, they get it because they're on both sides.
Are there any kind of elements of skill sharing? Because I know there's a lot of people who perhaps after they retire, they have a lot of skills and they might be dealing with a little bit of feeling obsolete, but because they're no longer actively employed in their skill set, is there any kind of bringing in some skill sharing or, hey, I know how to do my taxes, but you young 20-year-old, you can drive me around, that sort of thing?
Yeah, it doesn't get to that point per se. I think that happens organically a lot of times. And there's a lot of that happens when we are very intentional, when we have school groups that are participating. We'll often have, it's not like a panel per se, but the older adults will tell their life story and sort of give bits and pieces of wisdom in what's going on. I will tell you, in addition to all of the sort of tasks that we do, we're just very actively involved in the aging space, advocacy. We do a lot of seminars. We do a monthly seminar called a Little Talk, where we bring in experts on issues related to aging to talk about when is it time to give up the keys? How can you re-enter the workforce? The value of having a pet for your mental health, how to stay cool in the summer, all these things. And we partner with lots of different organizations to kind of devise those programs. We do a lot of social events, picnics in the summer, volunteer coffees and happy hours, holiday parties, because we know that just getting people together is worthwhile. So I don't
I
know
can
if that
imagine,
answers.
especially during the holidays, that might be something that you see an uptick in.
Yeah, we do programs where people just drop off goodie bags and write letters. And, it's all about shining a light on aging and older adults and, how we can make sure people don't forget these folks and keep them part of our communities because they have so much to offer.
Yeah, I can imagine. I can imagine there being a little bit of where when someone first comes in, like you said, they might have only one or two things that they want help with, but then either as their needs adapt or they start to realize, hey, I could actually, it opens their eyes a little bit more to the types of things that they might want a little bit of help with. And I can imagine that relationship evolving. Where do you pull your volunteers from? You mentioned that it's very intergenerational. And I know from our personal conversation that you sometimes bring in the local schools as well. Where do you pull your volunteers from in general?
All over the place, to be honest with you. We do advertising, marketing. You don't have a huge budget for all of that, but one of the primary ways that volunteers will come in is our whole, what we've been talking about mostly, you and I so far, is our main vehicle for connecting people, which is individual volunteers to individual members. We have a whole group project called Ditch the Desk, is the branding we came up with a handful of years ago that we think is pretty clever. Um, you know, and so groups will come to us and say, hey, a corporate group, Verizon or, whomever, Pinnacle Assurance, and say, we want to come out and do some service. We love your organization, what you do. What can you design for us? And so we'll send them out to do yard work or deliver bags or to do an art project here at our office. And so what we want then is them to have a great experience. So they say, I want to do this on my own time with my own family and friends. And so that's a great way, is turning over a lot of those groups. We have probably 100 groups a year come through our Ditch the Desk program. And then, we'll go out to schools. Kids are actually kind of a bit part of our volunteer base. Most of our volunteers are my age, a lot of recent retirees in their 60s. And you know what? The other part that's really cool is that we're getting old enough now that we've got people that started as volunteers in their 50s and are now accessing service as members. So there's that whole continuum and lifespan. I'm turning 55 next year. 55 is the year we start bringing people on. And so the rest of the staff jokes. They're like, Jake, when are you filling out your member application? Like, you better believe it. Because when I start having a problem, I'm going to want somebody to shovel for me. And so there's that kind of pay it forward. It's cliche, but it's true. Like, if you're a volunteer and you're doing stuff in your 40s and 50s, we hope that you're able to access an organization like this and a model like this when you're in your 60s and 70s and 80s.
Yeah, and honestly, I love it. Like every element that you're describing of this is something that America needs. I know around the world there's probably other areas that need it as well, but I know America, the need is felt and it's becoming more and more felt over the recent years. And what you're essentially doing, I feel like you're providing a way to reclaim a little bit of the benefits that we used to have from having a more integrated community and a little bit more of the village culture. I grew up in a small town where everyone knows everyone and all of that. And even there, you didn't have as much of a village culture as you could have, where people are helping each other out as a matter of course. But that is something that I feel like it provides a way forward without having to go backward in a way. And here's what I mean by that, that there's a lot of necessary changes that have happened in American culture, in American infrastructure, and all of that, where people are gaining more mobility, people are able to work from different places. There's a lot of more opportunity to be able to earn income and go live in different areas. Or sometimes the job market requires someone to move, kind of the ups and downs of all that. And some of that is necessary, but people have been asking. My background is in urban planning, and that is a question that comes up a lot, is just trying to take care of the community, trying to reintegrate, trying to find the community. How do you infrastructurally support that? And from my background, but what you're doing, it's honestly a program that you could pick up and place anywhere in the US. And like if you have a few people running it, start to build that network. And I love it. I love everything about this because it is accomplishing so many things that are needed relationally and support for older people, but also just it's simplicity, and you can do it anywhere. You can plop this down anywhere and start to work it. And so I love that. I'm wondering, is this also up where I am in the north of Denver? Are you all over Colorado, or is it just mostly around the
Oh, yeah,
Denver area?
good question. So we over the course of our history, we've served in a lot of different spots in Colorado. We've incubated a little helps, especially in a bunch of mountain communities, Salida, Roaring Fork Valley. Currently, we serve the majority of the Metro Denver area. I'm the Metro Denver director, so that's like 70% of what we do is in the Denver area, and it's our rough borders are kind of like the 470 corridor. And the reason we have that is because, not that we don't want to serve people further north or wherever or further south. It's just we have to have the volume and supply of volunteer to bring new older adults on, because the last thing we want to do is promise them something that they then don't get some help with. And so as we expand and grow, we kind of move and shift a little bit. But we also do, I have a counterpart up in northern Colorado that serves Fort Collins, Greeley, Loveland, Berthoud. Just we up until recently, we had a Grand Junction office that served the whole Grand Valley. But it's not always easy, because proximity plays a big role in what we're doing. And so I always tell people the last thing we want, this is a corny analogy or example, we don't want someone from Westminster driving to Parker to change a light bulb. It just seems like not a great. We want somebody in Westminster to find another older adult in Westminster who needs their help, because if you help somebody in your neighborhood, you're more likely to do it again. So that proximity is a big part of what we do.
Your comment about bringing in the corporate events and stuff like that, I assume for larger projects, or maybe they would just distribute them to different homes. Is that kind of how that works?
Yeah. So like a hypothetical project that we do, a yard work project in August, say a group will call us and say, oh, we've got 20 salespeople that, we've carved out a Friday to do some service. And we say, great, do you guys want to do some yard work? And yep, that sounds good. We register all those 20 people. And then, me and my staff will work with their point person and find them homes that already need some help. And then we'll just kind of divide them up and send them in groups of 4 or 5 to go do work for a couple hours. And then they usually get together somewhere afterwards for happy hour or lunch beforehand or whatever. Swap stories. Sometimes we'll meet them there if we can. And so that's a super popular project, because to me, it checks kind of all the boxes. You're bonding with your teammates outside the office. You're getting your hands dirty. You see the fruits of your labor. You actually get to visit with the older adult at their home. They see the work that you've done that they've been waiting forever to get done. They're not paying for it. They often, bring out lemonade and cookies, and the volunteers will take turns visiting with them. They may bring them into their house and show them photos of their grandkids or whatever. So, I mean, I'm painting this is a very wholesome picture I'm painting, and that's by and large how it happens. And so the picture I just painted to me seems like a win-win for everybody. We're as a staff, we're getting stuff done. We're, engaging corporate volunteers. The volunteers are, they're out of the office. They're outside doing good work, fixing things that, someone's had on a punch list forever that they can't do anymore. Change a furnace filter while you're there, move some boxes in the garage, what have you. And then the older adult, obviously, and part of it too is not just the work that they get done, the fact that 5 people are taking 4 hours out of their day to come to their house is so big for some of these people that are so isolated that don't have visitors. And so, yeah, as far as I'm concerned, everybody wins.
I love that. I love the ingenuity of it, taking advantage of the culture that is kind of pushing a little bit more of giving back, and whether it be a business's desire to give back as a corporation or whether it be individuals in that business who orchestrate it, you're giving them an outlet, and it's, like you said, it's a win-win for all of that. On that note, how does that work for vetting people? How do you make sure that you're sending the right people in, and also the people who are inviting them in are the right people? How does the vetting work?
Yeah, great question. So on the first side, individual volunteers that want to become part of our community and help people one-to-one all are background checked. So that's the first line of defense right there, is that, they have to pass that or else they don't get admitted. So if you're an individual and you're going to go help Betty in her home organize some boxes or do whatever, you've already passed that background check. And, when Tom, who's a volunteer, is helping Betty, who's an older adult, it's all synced up in our database. So we know who's helping whom and when. So that's the kind of first line of defense. For the corporate side and the ditch the desk side, they're not all background checked because those projects are all outside of them. And so obviously we're working with the team leader. It's an organization.
And you're there as a group as well. So there's a little
There's
bit
a group
more
there
group
as
accountability there.
Yep. Yep. And then on the older adult side, when they apply to become members, they get a home visit from a staff person or a high-level volunteer just to make sure the house is safe. We run our internal kind of background check on them just to make sure they don't have anything in their records. That being said, there's also a little bit of a leap of faith that things are going to go well. And 99 times out of 100, the interactions are great. And that 1 out of 100, that's my job, is to intervene when there's some conflict about whatever. And that's natural. It's human nature. We know that, not everybody's going to get along, or things could get a little sticky because of, one thing that not often, but that will come to my desk when there's an issue per se, is like a older adult might overstep their bounds in terms of what they're asking for. They're maybe unintentionally or intentionally taking advantage of the goodwill of the volunteer. Like they'll come over and say, "Oh, I need to go to the doctor." And then in the process of that ride, they're like, "Well, can you stop at the grocery store and the bank?" And next thing you know, the volunteer's like, "Well, I only had 2 hours, but it took 4 hours." That was kind of frustrating for me. So, as rosy as the picture sounds, just like any other operation, there are little kinks that always need to be worked out. And there's times when we have to let people go because they've, abused it too much, more on the older adult side when, they're not supposed to call our volunteers directly, but they get their phone number when they call for the first time to just say, "Hey, I'm Brett, coming over to wash your windows." And sometimes they'll just circumvent the system and go right back to you, Brett, and call you next week and say, "Brett, I actually have another task." And you're like, "Oh, I didn't really sign up to do that." And so, sometimes we have to slap their wrist, but it's all part of the game. And, we have to redirect certain people, and, hopefully everybody plays by the rules.
So it sounds like there's a good review or feedback process that's in the middle of that, just making sure everything's running well.
Yeah, and we meet as staff on a weekly basis to talk about members that might be struggling. And we haven't talked about this at all. There's a lot of times where we have older adults who we bring on, and then at some point they're well past a little help. And so we have to transition them to find more significant resources, care, what have you. You know, another thing I would just bring up at this point, which is really important, which I didn't mention in the intro and I should, one of the real humongous benefits of what we do too is that we give caregivers a break. There's so many people out there that have great hearts that are, you know, family members that are caring for their older loved ones. And that is hard work for a variety of reasons. And sometimes it can be in perpetuity. Like it's, you know, you're doing this endlessly all the time. And so a little helps
And
there
it's
to give that
24/7, like you
caregiver a
said, there's
break.
no break.
Yeah. And so we acknowledge that and we want to let those family members or whoever they are occasionally have time to just take a breath.
So are caregivers allowed to apply for aid?
They apply for their parents or whoever they're taking care of. And a
Okay.
lot of times, you know, if their folks aren't in a situation where they can put in the request, the caregiver will put in the request. They'll say, my daughter would say, call and say, hey, my dad, Jake, you know, needs somebody to come over and, you know, visit with him for 2 hours while I go take a break or I go do this, that, or the other. And so, yeah, this is corny to say, it takes a village. And so we're just one part of that puzzle.
So what does the future look like? You mentioned a little bit ago about wanting to grow, wanting to add a zero to the number of people you serve. One, what stands in the way of that? And what do you envision the future looks like when you do overcome that hurdle?
How much time do we have, Brett?
Let's do it.
Yeah, I mean, our intention and goal is to put a zero there. We fully recognize that it's not a linear path, nor is it an overnight thing, and that it's better to grow at a reasonable pace. And so we have to be very discriminating about where we go next and is it the right spot. And then, you know, a huge piece to that puzzle is funding. As I mentioned earlier, we don't have a membership fee. So our older adults that are receiving these services are a very small piece of the revenue stream intentionally. So we have to look other places for funding, for grants, foundations, individual donors, corporate sponsorships, you know, no stone unturned, because
Are you a 501c3? You can accept
we are.
donations and all that? Okay.
Yep. Yep.
Awesome.
We're a 501c3. So, you know, we get every day, I check the mailbox and there's checks from members. You know, there's a $5 check from Betty who loves what we do but can't afford it anymore. Or maybe there's $1,000 check from an investor or a grant or what have you. But we have to work at that all the time. So money's obviously important. And the other reason I bring that up is because we're very staff heavy isn't the right term, but we have human beings still communicating with our members. So that requires people power. So when an older adult calls in and says, I would like my windows washed or I need a ride to the doctor, we have a human that records that information in our database. So another piece to the puzzle is, you know, to scale up, we need to look at new technologies that will allow us to kind of connect more people more rapidly and efficiently. But there's also a cost benefit to that. You know, we don't want to take away that human element, especially for our older adults who may not have those technology skills and also like being able to talk to a human they know on our staff. But as our older adults are more technologically savvy, we can move in that direction to, you know, we're working on an app right now that connects people a lot more quickly. But we have to be very careful about how we roll that out. And we don't want to leave people behind or miss the human element, but we also want to serve more people more efficiently. So it's a little bit of juggling.
Yeah, I can see that on multiple points.
It's technology and funding. Oh, and the third part is always we have to recruit more volunteers.
Mm-hmm.
Hopefully people watching this are like, yeah, I like that. I'll sign up. And I'll just let you know right now, we won't bug you a ton. You know, if you sign up and you can only do 1 or 2 things a year, so be it. You know, I would love for you to do, you know, 1 thing a week, but it's all up to you.
We'll get back to that conversation in just a minute, but we have some exciting news to share. If you or someone you love has ever struggled to find the right provider for a complex illness, or if you're a provider that is tired of spending thousands of dollars getting new clients in the door just to find out they're not a good fit for your practice, then this one's for you. 194 million adults and 22 million children suffer from complex illness in the United States, causing over 80% of all American deaths. This isn't the fault of the patients or the providers, but the disintegrated system in which they live and work. Our research found that patients have to try up to 17 different providers and spend up to $50,000, with fewer than 20% of those actually getting cured. On the other side, most providers have to spend around $800 to get each new client in the door, and then have to waste precious hours screening, intaking, and diagnosing that client, just to find out the client is not a good fit for their practice. Now everyone has to start all over again, driving up costs and driving down success. Companies is getting ready to change this. We're launching The Care We Need, a new platform designed to streamline that process for clients and providers alike. The client will be able to enter their symptoms once in one place from the comfort of their own home. The platform will then assess their information and match them up with a number of relevant providers in their area and at their price point. The providers will then receive a warm handoff with pre-screened clients committed to their programs, intake data already collected and ready in hand. This may sound like a lot, but I promise you it's only the beginning of what this platform will offer. Go to benniscompanies.com to sign up for our newsletter, be the first to know about user testing opportunities, or donate to support this cause. As always, like, subscribe, and send this episode to someone who would benefit from it. All right, back to it. So regarding the funding, that is a difficult question, or at least a complex question of understanding what type of structure you have. It sounds like you're mostly based off of donations. And like you said, you can't really do a sales-based person because your whole point is bringing in people who probably can't afford a whole lot extra to pay for services and all of that, but you do still need to support a larger network. And typically I would look at what type of service or product can we start selling on the side to do that. I don't know how that would work here, but would you look more for a larger corporate partner, or like how would you look at increasing or maximizing funds incoming without simply relying on donations?
$1 million question. Don't have a great answer other than us continuing to do like what we're doing right now, is get the word out, because when people hear about it, their typical reaction is really like that idea. That's a cool mission. Seems like it's feasible. It seems like it's really beneficial for everybody involved. And then potentially figuring out how people can support that. So actually our main revenue stream is foundations and grants. And so
I was
there are
going to
people out.
ask if you had any kind of governmental help coming in.
Yeah, we get funding from the Older Americans Act, through sort of local, sort of quasi-government organizations. There have been some bills that have gone through Colorado legislature in the last couple of years that have been focused on older adults that we've been a beneficiary of. But truth be told, and it probably wouldn't surprise you, older adult funding is pretty low on the totem pole of all the issues that our country faces. It's not a super sexy issue.
Yeah, it's not as glamorous, even though it's incredibly important.
Yeah, and it's not always easy to market and advertise. If you show a picture of I'm a dog person, you show a picture of a puppy on screen, yeah, sign me up. I'll help. And, all the other issues, which are all really important and valuable, environment, kids, how do you strip funding from those to support older? So we have to work extra hard to advocate for funding through government, and government funding right now for nonprofits, that I don't have to tell you, Brett, is not easy. And so it's sometimes it's also like private foundations that, maybe someone really has an ear for this or wants to do this.
And I assume you are integrated into kind of church networks and stuff like that?
Yeah, we have a lot of faith-based groups that help as volunteers, but also as donors. And there are a lot of faith-based groups have older adults that need help too. So they can help us across the spectrum in terms of getting involved with us. So, there really aren't, I'll be honest with you, aren't a lot of organizations that aren't good fits, unless it's someone comes to us and like, I've got 1,000 employees, we can't handle that. But if you're, a reasonable size and, we can kind of work with you, we'd love to get you in the door. So, and it's, we have partners that we've worked with for 5-10 years that support us through sponsorships, like putting their name on stuff, and they work, they started as volunteers and they decided we like this mission, we'll sponsor your event or this program or just be a sponsor. So, there's lots of different ways to do it. It's just the pot is ever dwindling.
Do you have any kind of I'm thinking of something like Christmas charities and stuff that have sponsor this child or something like that. Maybe not with their actual story, but just say, here's how much it would cost to sponsor one adult for this many months or something like that. Do you have anything like that out there?
Yeah. So in our asks, in our philanthropic asks, a lot of them basically say, a gift of $200 basically supports this many older adults, coming on board, the cost of onboarding them, but also serving them. The crazy thing is that an older adult accesses all we have to offer and kind of takes advantage of the maximum range of services. It can save those folks in upwards of five to $10,000 a year. And
Mm.
so it really, and we talked about this earlier, Brett, the financial considerations of staying in your home for 2 to 3 to 4 to 5 more years, as opposed to moving to assisted living for people on fixed incomes on Social Security, is huge. I don't know if you've looked at assisted living, but it's $7,000 a month for kind of mid-range. A lot of people don't have that squirreled away. And so if we can keep you in your house and you paid off your mortgage, that's huge for you as an older adult.
Yeah, I bet. That makes me wonder, do most people have to like sell their house in order to pay for assisted living? Or how does you mentioned that you
Yeah.
guys help people with that transition?
Yeah, I mean, we're not huge in sort of the financial game. We have a lot of partners that, we'll refer people to when they're making that transition,
Hmm.
but it's not easy. A lot of people don't have that income just sitting around, and,
Yeah.
assisted living is very expensive, so they will have to sell their house, and it's very emotional too. If you've had a family there and you've been there for many years, giving up your house up there with giving up your keys and all the other things you kind of may have to give up at a certain point.
Hmm. So this is a slightly different question, but your note about you guys don't really do with the finances, and someone came to mind who like, hey, maybe this company actually might be able to partner with you to handle the financial stuff. So it made me think, are there other types of organizations or practices or types of wellness professionals that might be a good fit to partner with you guys in order to kind of like maximize what you guys are doing? That something that you guys don't take care of, but you have like a referral network or you have people that you work with, you trust to bring in and match those other needs.
Yeah. No, good question. We have a large network of people that, I mean, that's kind of also part of the package that we offer is resource navigation for folks, because a lot of times they'll call with something that's out of our sort of stratosphere. Taxes is one thing. Like, we occasionally will have volunteers that will come to us and say, "Hey, I'm a retired accountant. I could come to the office and people could come here and I could help them with taxes." We don't typically get into too much of that, but we refer them to free tax planning services. I will point out one organization you might want to look up. One of the guys who's kind of the founder of it is one of our original founders of A Little Help. It's called AgeWise Colorado. And it's basically a vetting service for everything older adult. And so their job is to create a whole catalog of service providers that specialize in helping financial, home modifications, healthcare. And so they've done all the work to make sure that the people that they put on their website are in it for the right reasons, a background check, so to speak, so that an older adult can do almost like one-stop shopping if they're looking for someone to do their will or someone to, do this, that, or the other. And
Or even just a business that doesn't maybe heavily rely on like interactions, as like people to people interactions, that sort of thing.
yeah, absolutely. And, we have some of those just in-house that will, someone will call and say, "Hey, I need lawn mowing services." Well, we don't do lawn mowing. Or, "I need tree services." And we've had people that we would suggest that they, because they offer a senior discount, or, they specialize in working with older adults for whatever they're doing.
And something that perhaps listeners might not realize that maybe you can expound upon the time that, for example, a lawn mowing company might donate to be able to help you guys out. That might be like tax, was it deferrable tax? Terminology escaping me, but
Yeah,
basically
no,
they might
absolutely.
get a tax benefit from donating that. And maybe, I'm not sure quite how that would work, but if they were to calculate the dollar amount of the time that they donated, maybe they'd be able to write that off, right off on taxes. Is that accurate?
Sometimes, I mean, we don't, like I said earlier, we don't wade too much into the financial side of things. We do know, though, some of the folks we refer will give discounts. And some folks, as you were referring to in your last question, might do pro bono work for older adults. And in that case, we're all about sending our members to them. Yeah, and they do it for a variety of reasons. Maybe they're doing it out of the goodness of their heart for a tax benefit, for both. Sometimes it doesn't matter to us, but and there's also like junk removal services. A lot of older adults have garages that are just packed full of stuff. And so we have a couple of partners that we work with that work specifically with our members and give them a discount, but kind of also understand what they're getting into. When they're working with older adults, it's not just I'm there cleaning everything out. I'm also working with them to understand, like, oh, that box of pictures, I want that here. Can you move that into the house? Or so it kind of takes a different hand to do some of this work.
A little bit of a softer touch.
Yeah, or just understanding, like,
Mhm.
this might be very sentimental. So, but yeah, I mean, that's really, and some of it's, referral for much more serious stuff. It's mental health referrals, it's dementia referrals, it's in-home care or what have you. But, we're equipped to be able to at least get them off in the right foot with a warm referral too. Last thing we want to do is just, here's a website. We're like, oh, call Brett at this organization. He works specifically, and we know Brett. He's a good guy. Boom. And that gives them peace of mind because it's hard these days.
So I want to circle back a little bit to the growth idea. So we know that you are focused more on Colorado, and a little help is kind of centered on Colorado and the different surrounding areas of Denver and all that. What about someone who wants to start something similar? Someone who wants to build a similar network or get involved in growing it? How does someone do that? In maybe they're in Alaska. I don't know, somewhere that it's not as predominant. Where how do they start a hub like Little Help?
Right, right. So we've over the years have been kind of working on what we call a playbook to be able to share with people that want to do this in different locales. I wasn't here at the birth of A Little Help, so there's a lot of calculus that went into when they started things that they needed to consider. I would say the number one thing that they would want, the two things, and we talked about this already, that are really critical to being able to start something like this, if you have staff, would be some sort of person that can get behind you financially. Like, we had seed money in certain places for people that wanted to do this, to kind of get us off the ground and fund a staff person for a year or two or what have you.
Develop the website, infrastructure, all of
Yeah,
that.
exactly. But then the other thing critical is where you are. Does it have a network of people that would be potential volunteers? And we talked about this earlier. If you can start something like this and you're in an area where there are older adults, they're going to come. So you don't have to worry as much about that. I mean, I did a bunch of kind of recruitment of older adults when I started, but I don't really have to do that too much anymore. So it's the volunteers and the funding are the two. I will say this again too. The other thing is the proximity, because sometimes we've started things in kind of rural geographical areas, and it's really hard just because volunteers get burnt out really fast when they have to drive a long way to do something. So the nice thing, in Denver is that, if you're a volunteer, you can find an opportunity to serve somebody that's going to be close to you. At any given time, we probably have 50 to 100 open requests in the metro area. So if you want to serve, you can find something. But if you're in Clear Creek County, or you're in Garfield County, or you're, in San Luis Valley, there's needs there, but that's hard. If you're, you look and you're like, oh, I want to help Betty, but Betty lives 50 minutes away. So
Maybe
those are things.
plugging in with a local church network or a local religious group network might be a good place to start, because there's usually a
Yeah,
lot
and you know
more
what?
people who
Small
are
towns are
interested.
great places. Like, if you're just kind of working in your small town and that's your hub, that to me is almost ideal. And it has worked for A Little Help over our history.
So, where could you imagine this if this started happening everywhere? Let's dream a little bit. Throw away all hindrances and let's dream if this could happen all across the US. What do you think would happen to our society? What do you think would happen to the people? How would things change if this idea was implemented all over the US?
That's a very deep question. I'm not sure I have a great answer, other than if this type of model became part of a lot of communities, my belief would be that first of all, mental health would improve. And we know this because we survey our community members, and by and large, they tell us that their lives have become enriched through participating. in this type of a program, whether they're giving or receiving or both. And so number one, all the financial, like the benefits for older adults are great, but it's really it's also the connection piece. We know people are becoming more isolated for all sorts of factors that we don't necessarily need to bring up: social media, this, that, the other, polarization. People don't know their neighbors as well as they used to. And I think that's kind of a given. We all know that. And so I think a part of the issue sometimes is, how do you interact with your neighbor? Do you know that they want to interact with you? But if you're doing it, if there's the vehicle of service is built in, and I'll give you the example, like a lot of kids that are doing this. I was a middle school teacher and principal beforehand, and I would bring kids to the older adults' homes, and they were kind of nervous and acting weird because they're like, I'm going into an older adult's home and I don't know this person. But if you have a task for them to do that's going to benefit the older adult, that can make it less awkward. And then once they do that, then the ice breaks and they feel like, you know what? I noticed that Joe has all these cool old John Deere tractors. I'm going to ask him about that. And then all of a sudden it takes off, and Joe lights up because he talks about the fact that, he grew up in Iowa and he learned how to, use a tractor when he was their age. And they're so interested because they're like, I've never ridden a tractor. And so it's just I go back to it, service as a vehicle for connection. Peace Corps does it. There's all sorts of Teach for America does it. I think it's just a wonderful thing. Serving others is so good for yourself. So if we were able to just place a little help in all these places without, as you said earlier, all the barriers or hindrances that you have to do to create a working organization. I don't know, in a perfect world, me, the dreamer, the optimist, I think it would make a lot of difference. Here's another real corny thing I say to people sometimes is, in a perfect world, a little help would go out of business, or we would not exist because people would just do this naturally. But unfortunately, it's not the case. And so that's why we exist, is to create that structure and that framework where people can do this and create networks where they wouldn't exist prior. So I don't know. That's a kind of long-winded, circuitous response.
I love it. I think it would impact everyone, because community is where everyone, it's the ecosystem in which everyone lives. And you're right, mental health is a huge part of community. I and my wife are parents of a young child, and they used to say it takes a village to raise a child, and I don't have a village, and I could very much want a village. And so just being able to essentially provide a vehicle for reconnecting society is essentially what a little help is doing. And like you said, it's service as a vehicle for connection. And it's a unique innovation, like we talked about, but also it's such an important thing that touches on so many different areas of health, of community, of connection, of cultural cohesion, of everything intergenerationally, different parts of town connecting with each other through these events, through these service-oriented connections. It's such an amazing thing that you guys are doing.
I was going to mention to you too, pragmatist in me says, oh, you need an organization to facilitate. And you need to do it at the scale that we're doing it. Yeah, you have to have staff and organization and funding. But there's nothing to say that community groups can't start little net villages like this wherever. And it could be a church, it could be a school, it could be a community center, it could be whomever. It does not really require funding and staffing to do this. Like a little help was before we had staff. It was just a group of neighbors that banded together. I think there was 20, 25 of them in Washington Park. And they just went around and they kept their eyes open. They said, oh, I noticed Doris down there just lost her husband. Let's see if Doris needs some assistance with anything. And they just put Doris on the roster. And then they said, Doris, call us when you need something, So that can happen without all this other rigmarole that we call a business.
Yeah, it's something that's very easily grassroots. One person can take it upon themselves to go walk their neighborhood and write down who might need help and give them their number, and then who might be willing to help. One person can do that. Obviously,
totally.
The bigger group you get, the more scale you can get. But there's a very low barrier to entry. Anyone can do this.
Yeah. We have a lot of, we have not a lot, but a fair now number of high school clubs. So it's an elective, a little help club. So we've incubated them, and that's so cool because then they just take it upon themselves. They create little groups within their club. We have one at one school. There's probably 25 kids, and they break into groups of 3, and then they meet and they look through our portal and they try to find an opportunity they want to do, and they do it, and then they report back to us. So it's certainly feasible at different levels, and it doesn't have to be some sort of grand national thing. I mean, I love it as a national movement, but it doesn't have to be a national organization that does this work.
So, Jake, how does one get in contact with a little help, with you, or with any kind of these village to village networks? Where do people go to get started themselves?
I'll start with the village to village again. If you Google, I don't have the phone number on me. And to be honest, I don't know how many staff they have. The Village to Village Network is a national consortium of villages. And just to remind people, a village is an organization that has volunteers that help older adults in a variety of capacities. Everyone's a little bit different. So if you Google Village to Village Network, it'll bring you to their website, which then I think Brett and I were talking about earlier, has a map that you just punch in your zip code. And so if you live in Cincinnati, it'll show you, there's 3 villages within 40 miles of Cincinnati, and you click on it, and this village, like I said earlier, I use the kind of corny, they just do bingo. I don't want to play bingo. This village actually does transportation, volunteers drive people, and they also do social outings. That actually sounds like something I'm interested in on whatever level, receiving or providing or both. So that's the village to village contact for people that aren't in Colorado or can't access a little help. And then to get in touch with us specifically, 2 ways. Main phone number is 720-242-9032. And you'll have to leave a message. We don't answer the phone live. We don't have enough staff to answer the phone live. But if you have a question about, how to proceed as a volunteer, as a potential receiving service, as a member, if you want to support us, we'll call you back and you can speak to a human about that. And then if you just want to browse our website and kind of see more about what we do on any particular level on volunteer or receive service side or whatever, see some of the projects we're doing, it's just alittlehelp.org. And so you can see my bio on there. You can email me through that, but I will just say if you want to ask me a direct question, just email me at jake@alittlehelp.org. It's the easiest way to get in touch.
Awesome. Thank you so much, Jake. Well, Jake, like I said many times at this point, I love what you're doing. I love your heart for people as an individual, but also a little help in the work that they are doing in Denver, in Colorado. And I'm really happy to hear that these larger hubs exist, village to village networks and all of that. And thank you for taking the time to come on and share about what you're doing at A Little Help. Thanks for joining us today. Be sure to check out our next episode here and use the comments to ask any questions or suggest any future topics. If this episode was helpful to you and you want to support our mission to improve U.S. healthcare and win the war on complex illness, you can donate any amount using the following QR code or the link in the description. As always, like, subscribe, and share this episode with someone who would benefit from it. See you next time.